Good afternoon. Welcome to Healthy Life Pharmacy. How can I help you today?
Good afternoon. I've been having a really bad headache since this morning.
I'm sorry to hear that. Is it a sharp pain or more like a dull, constant ache?
It feels like a dull pain on both sides of my head.
I see. Did it start suddenly or did it build up slowly?
It started slowly after I woke up, and it's getting worse as the day goes on.
Have you been under a lot of stress lately?
Yes, actually. I have exams coming up, and I've been studying late at night.
Lack of sleep and stress can definitely cause headaches. Did you sleep well last night?
Not really. I slept around 4 hours.
That could be one of the main reasons. Do you feel any nausea, vomiting, or sensitivity to light?
No vomiting, but bright light is bothering me a little.
Okay. Do you often get headaches like this?
Sometimes, especially during exam time.
It sounds like a tension headache. I can suggest a mild pain reliever like paracetamol or ibuprofen. Do you have any stomach problems?
I sometimes have acidity.
In that case, paracetamol would be safer for you. Ibuprofen can sometimes irritate the stomach.
All right, how many tablets should I take?
Take 1 tablet now with water. If the pain doesn't improve, you can take another one after 6 hours, but do not take more than 4 tablets in 24 hours. Okay, I understand. Have you eaten anything today? I skipped breakfast and only had coffee. Skipping meals and drinking too much coffee can also cause headaches. Really? I didn't know that. Yes, low blood sugar and dehydration are common causes. I guess I should eat something soon. Definitely. Try to have a proper meal and drink plenty of water. I will. Is there anything else I can do to reduce the pain? You can rest in a quiet, dark room for a while. Also, try to avoid using your phone or computer for some time. That might be hard, but I'll try. You can also gently massage your temples and neck muscles. That sounds relaxing. It often helps with tension headaches. Do you think I need a stronger medicine? For now, try paracetamol first. If it doesn't work or if your headaches become frequent, you should see a doctor. How will I know if it's something serious? If you experience severe pain, blurred vision, high fever, stiff neck, or confusion, seek medical attention immediately. Okay, I'll remember that. Do you have high blood pressure? No, not that I know of. That's good. Sometimes high blood pressure can cause headaches. I see. Would you like to check your blood pressure here? We offer free checks. Yes, that would be helpful. All right, please sit down and relax your arm. Okay. After checking, your blood pressure is normal. That's a relief. Yes, that's good news. How much does the paracetamol cost? The strip costs $3. That's affordable. I'll take 1 strip. Sure. Here you go. Thank you. Do you drink enough water daily? Honestly, not really. I mostly drink coffee. Try to reduce caffeine. Too much coffee can trigger headaches. I drink 3 to 4 cups a day. That's quite a lot. Try to limit it to 1 or 2 cups. I'll try. It might be difficult during exams. I understand, but your health should come first. You're right. Also, try to maintain a regular sleep schedule. I usually stay up late studying. Studying is important, but your brain needs rest to function properly. That makes sense. Short breaks between study sessions can also help prevent headaches. I usually study for 3 hours straight. Try studying for 45 to 50 minutes and then take a 10-minute break. That sounds manageable. Good. Do you use your phone in the dark? Yes, before sleeping. That can strain your eyes and cause headaches. I didn't realize that. Try reducing screen time before bed. I'll work on that. Very good. Do you should take the medicine every day? Only when you have pain. Don't take it unnecessarily. Understood. If you find yourself needing painkillers frequently, consult a doctor.
Okay.
Are you allergic to any medication?
No, I'm not.
Good.
You've given me a lot of helpful advice.
I'm glad I could help.
I was worried when the headache didn't go away.
Most headaches are not serious and can be managed with rest and proper care.
That's reassuring.
Remember to eat regularly, drink water, sleep well, and manage stress.
I'll try to follow your advice.
Great.
Here's the payment.
Thank you. Here's your receipt.
Thanks again for your help.
You're welcome. Take the tablet after eating something.
I will.
I hope you feel better soon.
I hope so too.
If the pain doesn't improve, feel free to come back.
Sure. I appreciate your kindness.
It's my pleasure.
Okay, I'll go home and rest now.
That's a good idea.
Goodbye.
Goodbye. Take care and get well soon. Good evening. Welcome to Good Health Pharmacy. How may I help you today?
Good evening. I've been having a fever and a bad cough since yesterday.
I'm sorry to hear that. What is your temperature right now?
I checked this afternoon. It was around 100.5 degrees Fahrenheit.
That's a mild fever. Do you also have a sore throat or body aches?
Yes, I have both. My throat hurts when I cough.
Is your cough dry or are you coughing up mucus?
It's mostly dry, but sometimes there's a little mucus.
I see. Do you have any breathing difficulty?
No, my breathing is fine. I just feel weak.
That's common with fever. How long have you been feeling unwell?
Since last night, I felt cold and started shivering.
Did you take any medicine yet?
No, I wanted to ask you first.
That's good. I'll suggest a paracetamol tablet for the fever and body pain and a cough syrup for your cough.
Okay, how often should I take the paracetamol?
Take 1 tablet every 6 hours if your fever is above 100 degrees Fahrenheit, but do not take more than 4 tablets in 24 hours.
Understood.
For the cough, I'll give you a syrup suitable for dry cough. Take 2 teaspoons 3 times a day after meals.
Will it make me sleepy?
It may cause mild drowsiness. It's better to avoid driving after taking it. That's fine. I'll mostly stay at home. Good. Are you allergic to any medicines?
No, I'm not allergic to anything.
Do you have any chronic illnesses like asthma or diabetes?
No, I don't.
That's good. Try to drink warm fluids like tea or soup.
Should I avoid cold drinks?
Yes, avoid cold drinks and ice cream for a few days.
Okay.
Do you have nasal congestion?
Yes, my nose feels blocked sometimes.
I can give you a saline nasal spray. It will help clear your nose.
Is it safe to use?
Yes, it's completely safe and can be used twice daily.
All right, I'll take that too.
Are you getting enough rest?
Not really. I had to attend classes today.
Rest is very important when you have a fever. Your body needs time to recover.
I'll try to rest tomorrow.
That's good. Also, eat light but nutritious food.
I don't feel very hungry.
That's normal. Try eating soup, fruits, or soft rice.
Okay.
If your fever goes above 102 degrees Fahrenheit or lasts more than 3 days, please consult a doctor.
I will.
Also, if your cough becomes severe or you feel chest pain, seek medical help.
Got it.
Do you want vitamin C supplements? They can support your immune system. Yes, that sounds helpful. Take 1 tablet daily after breakfast.
Thank you. How much do I need to pay?
The paracetamol is $3, the cough syrup is $6, the nasal spray is $4, and the vitamin C is $5. The total is $18.
Here's my card.
Please insert it here.
Done.
Payment successful. Here's your receipt and medicines. I've written the dosage instructions on the boxes.
Thank you so much.
You're welcome. Should I take the paracetamol immediately? Yes, if you have a fever now, but take it after eating something.
I'll eat first, then take it.
Good decision. I feel very tired. Is that normal? Yes, fatigue is common with fever. Drink plenty of water to stay hydrated.
I'll keep a water bottle near me.
That's a good idea. Can I take a shower? Yes, but use lukewarm water. Avoid cold showers.
Okay.
And try to keep your room well ventilated.
Sure.
Do you live alone?
No, I live with my family.
That's good. Ask someone to help you if you feel too weak.
I will.
Also, cover your mouth while coughing to prevent spreading infection. Yes, I'll be careful. If anyone else in your family develops symptoms, they should also take precautions. I understand. Do you have a thermometer at home? Yes, I do. Check your temperature every 6 hours and keep a record. That's a good suggestion. Thank you. You've been very helpful. It's my duty. I hope you recover quickly. I hope so too. Remember, if your condition worsens, consult a doctor immediately.
I will. Thank you again.
You're welcome. Take care and get well soon.
Goodbye.
Goodbye. Stay safe.